Hey, Bulvinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Lavilati. A massive nakavakalevu to everyone that have been following our social media pages, especially right here on a brand new YouTube channel, Nakavakalevu. Today with us in studio, we've got a very special guest. He's a very familiar face here at Oceania Hospitals, and you might have seen him on one of the earlier episodes, Dr. Rubaganesh, our very own urologist here. Bulvinaka, Doc, welcome to the show. How are you?
Fine.
I know it's been a hectic week, yesterday you were down in Tavua and today you're currently in at the Good Life Medical Center doing your outreach program. And for those of you who are watching, if you're around Nosori, go down to the Good Life Medical Center and you can also try and get a consultation with our urologist, Dr. Rubaganesh. Right, just to kick things off, there's a topic that's often raised through our social media platforms, especially our messages and the emails and the queries that we've been getting, and that's on men's sexual health. Could you just briefly describe what does men's sexual health pertain in terms of your profession?
Yeah. So men's sexual health of late has been a topic of discussion, especially because of the change in the lifestyle, the current lifestyle, which is a stressful life, where we are prone to get addicted to smoking or the high fat and the high calorie diet which we are consuming nowadays with the less of fresh fruits and vegetables. So these all add up to a decline in the men's sexual performance. So in my clinic I see men complaining of erectile dysfunction. Erectile dysfunction is the loss of rigidity in the penis during the sexual act, and a condition called premature ejaculation. Premature ejaculation is the emission of the semen before the man is or the woman is completely satisfied with the intercourse. And there is a decline in the fertility as such. There has been observed worldwide the decrease in the seminal cell counts has been observed worldwide, and this is also a major problem in men, which leads to infertility. And there is a loss of interest in sex as such because of the hectic and the stressful lifestyle which we have been following. And we need to rule out the possibility of decrease in the testosterone levels in such cases.
Thank you. It's quite a lot surrounding men's sexual health, and we'll dive deep into that. But for those of you who are watching, Dr. Rubaganesh has got an outreach plan, so he'll be in Tavua, Labasa, Savusavu, the West, and everything. And once he's back, you can also consult with him. But for more information on the outreach programs coming up for Dr. Rubaganesh, you can check out our Facebook page. All the details for the upcoming trips are there, and if you're within that particular area, be sure to lock the dates down and see him at the location that we have provided. Right, just jumping right in, and this is something that's quite intriguing because in terms of technology, in terms of innovation, this is something that we're basically proud of here at Oceania Hospitals, and that is laser kidney stone removal. Yeah. Tell us a bit more about that.
Yeah. So kidney stones, conventionally we have been managing with open surgeries or trying to get into the kidney through a hole made in the kidney. But right now, with the most recent technological developments, we have been able to access the kidney through the natural orifice with a very small instrument through which the kidney stones can be removed, and that too with the latest technology called laser. Laser is the energy source through which the kidney stones are broken. And this recent development in this minimal access or no incision surgery has been a boon to patients with kidney stones. So we at Oceania Hospitals, we have this technology which has been recently introduced, and we are proud to introduce this to our community so that the number of patients who can be benefited with this technology can be increased.
Thank you. Just in terms of patients coming in, and who are probably in need of this treatment, do you have any advice in terms of preparation or in terms of prevention?
Yeah. So kidney stone prevention as such is kind of a gray zone, in a sense, like it's not entirely in our habits, or it's not entirely up to us to prevent kidney stones. So the prevention of kidney stones, which we usually advise to the patient, is increase the amount of fluids which you take, especially during hot weather when there is a loss of fluid from the body. Better to rehydrate, have your hydration like always up to the mark, so that even if there is a small stone, it can be flushed out of the system. That is one of the main prevention methods we advise. And apart from that, it depends from person to person. So the urologist, when we consult you directly, then we will be able to tell you more in detail about the prevention methods, and also about the treatment options available, especially the laser options are very minimally invasive. So the patient's preparation as such is not that like rigid in like any other open surgery. But patients who are having comorbidities like diabetes or a high blood pressure, or patient with a heart disease, obviously they need to optimize these conditions and need to consult the physician or the cardiologist and get the problems which they have been having previously treated, or optimize it before surgery.
Thank you very much. It's quite an interesting, topic that we just dive into, and you can get a lot more information if you check out our website. If you can just call in and query for this, or if you can just drop us a message on Facebook. Right. Just one last thing. Like I said earlier, you've got an interesting lineup of events in terms of outreach. We've got the West, we've got the North, and right now we're currently in Nosori right now. And if you're watching this today, we're in Nosori. So come on down to Good Life Medical Center and to come and check out Dr. Rubaganesh. But just one thing, what can they expect? What can the people expect from this outreach program?
So outreach program is basically for the doctor to come at your doorstep, be accessible to you, so that you can get your queries cleared. You can have a basic consultation and a clinical examination, and we will be able to guide you to come to Oceania and to get other further investigations like the ultrasound or the CT scan done, so that you may be clear about your diagnosis.
Thank you, Doc. Riverside Medical Center, we were in Tavua yesterday. Today we're now, like I said again, in Nosori. So if you're around Nosori, please come on down. If you're around the Timbara area, come on down to Good Life Medical Center to come and get checked and come and see Dr. Rubaganesh. But for the rest of our outreach trips, check out our Facebook pages. And because here at Oceania hospitals, healthcare does not end at the doorstep. We go way beyond, and we go far beyond expectations. So, on that note, thank you very much, ladies and gentlemen, for joining us on Health Talk with Oceania Hospitals. Till next time, Naka.